Okay, good. Sorry, let me just share the screen. Good evening, everyone. My name is Dr. Nasser Ali, and I'd like to welcome you all to this webinar organized by the Young Professional Society. This is one of many webinars that we have been holding recently, and the aim of these webinars is to try to get people, professionals from all around the world to come on and for them to speak about their professions, what's involved, and give advice on the profession so that youngsters who are listening, who are watching, take some inspiration and take some advice. So there may be many youngsters out there who want to become surgeons one day themselves, or doctors and that, or different professionals. So the purpose of these webinars is that youngsters take advice, and the Young Professional Society actually provides an opportunity, a platform for youngsters to network with other senior professionals. And today we have a webinar on given by our distinguished guest, Professor Dr. Ahmed El-Mallul, who is based in Poland, and he works as a general surgeon in Poland. And today we will be interviewing Professor Ahmed and asking him about his profession, what's involved, and see what advice he gives to youngsters who want to become surgeons like him in the future. So I think before we go on to our interview, I would just like to share a few slides with you, giving you some information about the Young Professional Society. This society was actually set up. This society has been set up to help and support youngsters with personal and professional development. And we aim to impact the lives of youth, the young people, so that they transform and become successful professionals and the real representative ambassadors and leaders of their communities and the wider society. And there's an urgent need in this area. And although the youngsters are becoming very, very smart nowadays, getting very good grades in their schools and in colleges and that, and get offers at universities, however, they lack a lot of the soft skills, which are also very, very important. And that actually prevents youngsters from succeeding in their careers in later life, in their working lives. So the society, if you could please mute your mics, the society actually focuses on 3 areas. So there's 3 pillars that we work under. Number 1 is communication, number 2, leadership, and number 3, innovation. So these are the 3 things, and all the activities we run under the Young Professional Society can be categorized under these 3 pillars. And some of our activities include, we run a number of clubs which actually teach youngsters about the soft skills, about good, effective communication, about, we have the Young Speakers Club, we have the Writers Club, the Entrepreneurs Club, Advanced Study Skills Club, helping youngsters to develop better techniques in order for them to do better in their exams. We also run some courses, again, on soft skill development, on leadership courses, about writing with clarity and impact, about innovation, about entrepreneurship. So there's many courses that we do. And we also host a number of webinars, and I'm sure many of you have been following with our webinars, and today's webinar is an example of that, the work that we do. And those people who have not been able to join us for our previous webinar, you can actually see these on our YouTube channel. If you go to YouTube and type Young Professional Society, you'll be able to see all our webinars. Now, because it's a society, we also provide memberships. so people feel affiliated or they get affiliated to a learned society, and we provide mentoring to youngsters on their careers. And also we provide an opportunity to network. So youngsters at an early age get an opportunity to interact with the senior professional, and that will hopefully help them with their careers. And for people who want to know more about the society, you can visit our website, www.ypsociety.uk. We're on Facebook, on LinkedIn, on Instagram, on YouTube, and you just need to follow, type in Young Professional Society and you can keep updated. We're also on the WhatsApp. So if you want to stay updated with our activities, you can take a note of this number that you see in front of your screen and send me a message, and I'll be happy to add you onto our WhatsApp group. And there's also an email there. So I think what we'll do now, without further ado, we will go on to our interview. And co-hosting with me today for this interview is Professor Waqar Ahmed, who's from the University of Lincoln, who's the president of the Young Professional Society. So he'll be joining us, Professor Ahmed. I think we'll start. So Professor Ahmed El-Mallul, let me welcome you. Thank you very much for your time. Thank you very much for joining us today. I would like to welcome you. I hope everything is fine on your side. You're based now in Warsaw, in Poland, so I understand there's 1 hour difference there. To start off with, please, can you maybe give us introduce yourself so people who are watching us now, give an introduction, because I see you're from Libya, but you're settled in Poland. So maybe you could give us an introduction about yourself.
Yeah, thank you very much. I'm honored to be invited for the Young Professional Society. I'm honored to be invited from Professor Ahmed Al-Waqar and from you, Director Dr. Nasser Ali. Maybe some of my friends from Poland or from Libya or the other countries are now logging here. Didn't knew some. Professor Ahmed is the president of Lincoln in a UK university. And Dr. Nasser is most famous people who and Professor Ahmed is these people, gentlemen, they're most known people for the nanotechnology in all over the world. From the USA to Europe to Indonesia and Japanese and Africa, they are known in this field. So I'm very honored to be invited here to help the younger people to develop their self-personality and to know how to innovate thinking and understand the innovation and intellectual properties, and to be as smart as possible and to share with the seniors their experiences. We need a place like this. So I'm very thankful. I'm very thank you. And my name is Ahmed El-Mallul. Yes, I'm coming from Libya. I'm born in a place, a small city, I said always, is the door of desert in Libya, 180 kilometers from Tripoli. I started my basic education, elementary school, secondary school there, and I moved after that to the capital in Tripoli, and the high school have been managed. So I get the possibility to study in Europe. There were in that times some government helping for the people, for clever people, go to study in Europe, in the UK and in Italy, and I have been going to Poland. I choose Poland, and I start my medical education in the University of Medical of Lodz. So I find a nice place in Poland. I find nice people, and I found a very good education system. So I finished my education, medical education. I became GP doctors and go back to my country to work 3 years. I'm coming back for the next 6 years to be a specialization of surgery, general surgery. And after that, I'm doing my PhD and so on. It has been a long, long way and a long, long time. And after that, I took the activity of education activity. I'm actually a professor of Zindan University and Lipinski University in Kielce and Technical University in Lutz. We are focusing now, my scientific activities are focusing how to use the nanoparticles generally in medicine, especially in surgery. So it's the other point. So, and I'm working as a head of department of surgical department. As every day I'm full senior surgeon. We have here in Poland about 600 hospitals and about 600 departments of surgery. We leading about 2 million operation, a big operation here in Poland. I'm just in the best of 200-300 surgeons in Poland. So I hope I will improve. I'm just promise you I will be improving myself to be one of the best surgeons in Poland. So, and I'm happy to share with you my experience and my long way to come from Africa to Europe to tell you about the foreign country, foreign language, foreign studies, and so on and so on.
Okay, so how did you move from Libya to Poland? What about, when you were studying in Poland and in a foreign language, did you know Polish? You had to learn Polish, or were you taught in English there? Or?
No, in Polish it was at this time when I had the grant, the government grant. Just go to open the atlas and looking for where is this Poland in atlas? Where is this place in Europe? So I didn't know anything about when I came as a young guy. I had 70. So my 18th to come here in Poland. I spent 1 year, about 1 year, a course of Polish language. This is the beginning, and after that, I passed the examination for the language, and we had the other examination to be a student of medical university from physics and chemical and the other topics. We passed it. I passed it, so I came to be a full student of the university. I was very happy.
Okay. Professor Ahmed, if you could bring the microphone a bit closer, because there's some problem with.
Yes.
Yeah. So now it's better.
Is it okay now?
Yes. We can
Is
hear
it okay
much.
now?
Yes. Yeah, maybe you can keep it there. Is it a laptop you're on or your mobile?
Mobile and my mobile. The laptop, I don't have a good connection, so I was afraid to have a technical problem.
Okay. Yeah. So fine. That is much better now. So was there anyone who inspired you, when you were young, or did you have a role model when you were young that you used to look up to and say, oh, I want to become like him, I want to do that?
Yeah. The inspiring of mine is my father and my mother and the brother of my mother. They are brothers of my mother. My family, they inspired me a lot, and they supported me a lot. And they are supporting me until now. I'm just an old man, and they are still supporting me. My my father and my mother is still living, and they're still calling me, and they're still giving me advices, you know, and they are inspiring me how to be active and how to be a leadership and how to be the innovation. My father is a very innovative man, you know.
So were you one of many doctors in your family, or were you the only one in the
No,
medical
in my
field?
family, I have two brothers. One of them is doctor, and two others of them, they are a medical education, but they are not doctors. Yeah.
So you said that when you completed your studies from Poland, you went back to Libya to work as a GP.
Yeah. Yeah.
Yeah. And then you became sort of went back and wanted to become a surgeon.
Yeah. Yeah.
Okay. Why was that? You didn't prefer the GP life?
Yeah. No. 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 You know, the fact is, in the beginning, I wanted to be a cardiologist. You know, but in the hospital where I was working in Libya, I met a very good surgeon from Philippines. His name is Valdez. I just remember him very nice. He is a very good surgeon, and he's just helping me to deal with the basic surgery, small surgery, and basic surgery. And I saw that is helping the people. That is just saving people's lives. So I decided to become a surgeon. You know, I would like to say that surgery, it's some kind of personality. You can't be another specialization. You know, and after if you become a surgeon for a long time, it's become a way of life. You have to have a personality to make a quick decision, to live with the stress, and you handle the stress, and you live in the edge of life. You know, it's a very hard work, and you have to make a decision with saving or losing the people. Your decision is very important. You are a real doctor. The surgeon is a doctor. We need him in the wartime. We need him in the peacetime. We need him every day. If there is something going wrong, for example, in every simple accident, you need a surgeon. Nobody will come to you, only surgeon. So you have to be a guy who did not see the details. The surgeons never see the details. The surgeon see the all. You will not so what's the guy have a t-shirt. You have just save his life. You will not say, you will not see what's the color of skin or the religion or, no, you never see that. You just have to go and to help the guy. And after that, you see the details. The old surgeons, just like me, after that, they have some problems with this in life, yes. You never see the details. Somebody like the details. So that's why I became surgeon. My personality is a surgeon.
Yeah.
And I love them.
Yeah. So you mentioned that there is a need for surgeons all the time, and these surgeons are the real doctors. So what about the job prospects for a surgeon? So somebody qualifies and becomes a surgeon. You think that they shouldn't have any issues with getting a job? And
yeah, you know, it's here now in Poland, getting a job as a surgeon is very easy. They are in need, indeed. A lot of places needed a surgeon. A lot of places in whole Europe needed a qualified, good surgeons who are dealing with the stress and dealing with the patient, knowing how to make the reaction. It's good, but I would like to say for the younger people, it's a hard work. No joking there. No joking there. You have to make a very quick and very important decision. You have to go to the patient after making your examination and tell him, I have to operate on you, but I'm not sure if you're not gonna die. And you have to be brave as well. You're going outside of theater. If they are bringing you some car accident, a lot of rupture of spine or liver ruptures or intestines or aortal rupture, you can't save his life. You have to go out to tell his family or her family, we lost her. They're gonna cry. You have to deal with this.
Okay. So yes, so obviously, as you mentioned, surgeons shouldn't have a problem in getting jobs. And you mentioned it's a difficult job. It could be stressful. You have to inform patients. You need to operate. You need to inform their families once you lose, a patient. So it's a difficult, yeah. But at the same time, is it quite? Are the salaries attractive as well? Youngsters who sort of wanting, they're well paid. The surgeons are well paid.
Yeah. Is that the case? No. The payment is the second look. Most of cases we are successful to save the life.
Yes,
this is the satisfaction to save anybody's life. It's making you full of happiness. Believe me. You see the smiling of this patient, smiling with his family, smiling. You don't have any money anymore. You don't need.
We're just sort of saying that people who work hard, youngsters who are working hard, and that they need to know. Obviously, they get the satisfaction from saving lives. Yeah, this is why they want to become a surgeon and enter the medical field. Okay. Thank you very much.
It's good paid. Yeah. It's good paid. It's good paid. Professional. It's good paid. Yes.
Dr. Bakar Ahmed, maybe you want to ask something, or I can continue.
Yeah. So obviously, there's a lot of education and training involved. What extra training is involved in becoming a surgeon after you've done your MBBS program?
Oh yeah, Mr. Professor, it's a long time. You after the medical GP to be a GP doctor, you have to start your specializations. Go to find some good surgeon as a head of department who will take you under him, and he will agree to learn you the secrets of surgery. The surgery is specialization. You cannot learn it from the books. Never. You have to. A lot of secrets they are never wrote in the books. So we started our training. It took about 6 years of training and education. You started as a young doctor and become a registrar, and after 6 years you pass the examinations and become a surgeon. But in the meantime, a lot of your friends and your chief, specialization chief, he is looking at you. He's looking at your hand, and you're looking how you're thinking, and you're looking how to deal with the patients. And you have to be good, really good. There is a lot of people starting surgery, but they are going to the other specialization. They are not finishing the surgery. You have to learn a lot of theory, but you have learned more of practice. You have a lot of duties, a lot of operations. It's a long time. Yes, it's a long time.
Okay, so your title is as a general surgeon. You perform general surgery. What does that encompass? What is it, sort of around the stomach area, or you go towards the heart as well? And
Yeah, we're just operating the abdomen. I would like to say a few words. In our system here in the Poland, we have the surgeon, general surgery, have to deal with two kinds of surgery. Emergency surgery, where you have a very hot cases. You have acute abdomen. You have car accidents, motorcycle accidents. You have a lot of acute patients. And we have a planned operation. It's just you can plan it. It's just in a cancer case or the other planned operation, gallbladder or bile ducts operation. So in a planned operation, we have, yes, we are dealing with the stomach, benign and cancer tumors, and we are dealing with the gallbladders, stone gallbladders, and the stone bile ducts, and we are dealing with the colon disease, a different disease, non-specific inflammation of bowel disease, and intestine disease, and we are dealing with the hernia, a different hernia we have in the abdomen wall. We are dealing with the varicose vein, and we are dealing with thyroid. We have done a lot of thyroidectomy. We have here in Poland, we have a lot of patients with the thyroidectomy who need it. And the beginning of my career as a general surgery, I've been working in that time. There is no difference between general surgery and the vascular surgery. We have done a lot of operation in aortal, bypass aortal, in the different places. We are occlusion of some different of lower limb, and that is what the general surgery dealing with every day.
okay, so could you please describe a typical day at work for a surgeon? How do you start in the morning? What happens?
Yeah.
Can you describe?
Yeah, I will describing my day. Okay, I'm just going to the hospital. I have been working in different hospitals, about 4 hospitals. It's a different hour of start. We can start at 7 o'clock or 8 o'clock. It's a different. Nowadays, we are just starting with. So I'm just going to the hospital, going to my office, and so at 8 o'clock, I'm going to the place where we have meeting, a morning meeting. We are just describing and thinking and talking about every patient we have in our department. So after that, we just go into the visit patient, talk with them. It took usually about 1 hour. And at 9 o'clock, I have to go to the theater. We have prepared the patients, it was planned before. Nowadays, we have problems with the COVID-19, you know. We have to make investigations for the COVID-19 before. And so we have less procedures, a little bit less. And we go to the theater. After making the surgery, it's about 2 o'clock. I'm coming back to the department and take care about discharging people, to sign all the papers, and to take care about the investigations we have the morning, just give it. The day of work is different. We have any case, acute case, sometimes 5 o'clock p.m., sometimes 6 o'clock p.m., sometimes 3 o'clock p.m. if we don't have any emergency cases. And after that, after a day full of stress and full of organizations, you have to go to play a football or a swimming pool, or you have to go to play a golf. As you see, this is some of my golf award where I played.
Okay, thank you. Thank you very much.
Can I just ask, can I ask a question? How do you think technology how do you think developments in new technology change the way surgeons operate?
Yeah, thank you, Mr. Professor. It's a very good question. Believe me, I have been working here in surgery about years nowadays. So it's making a lot of development. You have to be every year with a different conference. You have every year to go into different courses. I'm interesting now, and I'm doing a lot of cooperation with the minimal invasive surgery. It's laparoscopic surgery, and we are doing a minimal laparoscopic surgery. Non-laparoscopic is still more minimal. So you have to learn it. You have to train that. You have to have a new personality inside to learn that. For the seniors, most of seniors do not like new methods. Good in it. You have to envelop yourself. Yes, that's right.
Okay, can I just ask you, what are the major operations that you have done, and what kind of complications have you met? Are there any sort of major?
Yeah. It's a lot. It was female, and she had a tumor who had 15 kilograms. You know, I still remember that. And about 1 year ago, I had a very young guy, 17 year old, was bleeding from the colon. It's massive bleeding from the colon. It's had to be a very, very quick, and you have to do colectomy. All we only have to to make it through. You know, a lot of cancer, colon cancer. Sometimes thyroidectomy is a very, very hard operation. It's a lot of bleeding. It's a very hard operation. Sometimes the longest operation have been done, it took about 12 hours, you know. And the complication is different. It's a very different complications. From the abscess in the place where you have to make the operation, from not the healing of anastomosis between the intestine and the colon, and anastomosis between the stomach and the anastomosis, and some of the gallbladders bleeding after the operation. We have just in hernia. We have put a mesh inside this place. We got about 2% of infection, of mesh infection, which we are now trying to heal with this, with the nanoparticles. And we have a complication of unhappy patients, at least, you know, he's just unhappy. You don't know why. You just saving life, you're doing a good procedure, but he's unhappy. So what you can do?
Thank you. So has it ever been sort of whilst you're operating, you find a foreign object or so in the body or so, and which you take out while you're at it, yeah, or something? What kind of things have you found?
Oh no! Whatever you just keep in your mind, you can find it in the intestine and in the body. Everything, you know, it's from the needle to the coins to the you know, chicken bone. Chicken bone, it's very hard to take it. It's just come and perforating the intestine, or they are swallowing at different things. You know, and sometimes people from the prison, they are taking for us, and they are swallowing different things to go to the hospital. They want to be outside of prison at least 1 week or 2 weeks. And you know what? We are doing the procedure of surgery, and you open the patients. You never know what you can find inside. The anatomical structure is different, you know. So it's
Yes. Do you face any ethical problems in your work?
yeah. It's there are a lot of problems just like this. We here in Poland, we have some kind of religions with you can't give him a blood transplantation, transfusion. So you have to help him to save his life, but he didn't want. If you do a big procedure, a big operation, you have to have a blood in case of bleeding. Sometimes the patient is bleeding, and they want to make a blood transfusion. The other ethical points is it was with the AIDS patients, with the hepatitis patient. You have to you have to operate them, but you must forget about the other causes, and you have to do it. Yes.
Okay, so you mentioned that at the end of the day, after performing your duties as a surgeon, you must go and play golf, and obviously it's a stressful job. But does how do you handle the stress? Okay, you play golf and that, but does it also impact on your private life?
Yeah, that's right. I would like to say for the young people, for the maybe my friends and colleagues in the near future, become a surgeon, a doctor, a surgeon. I think the surgery, you can't handle it in a good way without the family support, without loving your family, without believing in yourself, without, a surgeon have to believe himself. No way. If you are not believing in yourself, you can't do operation. So, and you have to make some sports, to have a good relation with the other friend. Yes, you have, I think there are some statistics which showing the problem is of private life, of surgeons' private life is a lot. Divorced and and other things. They are, believe me, it's a lot of, yes.
Okay, yeah, just a last few questions. In addition to medical knowledge and know-how, what other skills makes an outstanding surgeon? So which are the skills that are required?
Excuse me, just can you repeat? I couldn't hear you. I have problems with the communication. Yeah, can you repeat?
Yeah, my question was, yeah, in addition to the technical knowledge, medical knowledge and the know-how, what other skills are needed to make an outstanding surgeon? Which are the skills?
Yeah, to understand surgery, to be a surgeon, as I said, you have to have your personality, and you have to improve your knowledge every day. Believe me, it's very important to deal with it. The things different, the things changing. The procedure is changing. You have to learn, and you have to be in touch of the knowledge of medical knowledge.
And obviously, you would need to be a good team worker, work in
Yeah.
teams, and have strong soft skills, communication skills.
Yeah,
Which
you
are very
have to be. There's no surgeon who can deal with the surgery alone. You have to play with the team, just like a football. You have to make a good communication. And during the operation time and after the operation time, everybody has, and during the time of operation, we have to have a leader. There is some communications. You cannot make a discussion. If you allow of that, the operation is going well. We can sometimes discuss about something, but if the things goes and you focus of your working, there is no discussion. They have to hear you, and they are all of them doing together, playing together. Yes. The communication is very important. You have to say it nicely, loudly, and with effects.
Okay, so say for example now you're a surgeon in Poland, in Europe. Are you able to sort of move around to different European countries? And I know in the UK we're pretty much going through this Brexit process now, but are surgeons, can they actually move around different countries and practice, or do they need to sort of sit some more courses or pass some exams before they can practice? Or
No, first of all, I'm very sad that the Britain is going out of the European Union, because it's a big country and a good country, and we have a lot of good surgeons. Believe me, yes, we can move around, but you have to learn the language. If you would like to go to Germany, you have to learn German language. You have to go to France. You have just the language. You can find work. I have a proposition of work a lot from Germany and from France, and from Spain. You don't need any notification, any examination, only the language.
so somebody who is qualified as a surgeon from non-European countries, could he come into, say, Poland to practice
Yeah,
as a surgeon?
yeah, but he needs to pass the exams. Yeah, non-European country, he needs to pass 2 exams. He needs to start with the GB exams as a doctor, and after that, he have to spend few months in a different clinics to show he is a good surgeon. After that, he get the possibility to work as a surgeon. Yeah. It's not easy.
I think I'm done on my side, Professor Dr. Bukar. You want to ask something, and we'll ask our viewers, people who are listening in now or watching us. If you've got any questions, either you could raise your hand, you can type in the chat box. Dr. Ahmed, you want to ask something?
Yeah, if obviously there's different areas of speciality. So you've got orthopedic surgeons and heart surgeons and maxillofacial surgeons. Which eye surgeons, which speciality would you recommend for youngsters to get into?
It depends of personality, as I said. If he want to work good, good payment, and you don't have a lot of stress, it's eye surgery.
Right.
If you have to work hard and you don't have to make a lot of stress, you have to go to orthopedic surgery.
Right.
If you have to be nicely work and good payment, you have to reconstruction surgeon of the, it's, you know what I mean. And
yes.
and if you want to, so working hard, neurosurgery is working hard, and now a lot of effects, in general surgery, working hard, but you see how you're saving it. And in neurosurgery, you are maybe saving his life, but his mind you cannot save him. It's a lot of complication after operation. So it depends what we're looking for. I would like to say for young people to come to me with the general surgery. But honestly, I will INT, eye surgery, yes, it's a good surgery.
The other thing is, if you look at lots of different professions, so say you look at sports or whatever, say tennis, people are motivated by winning titles and breaking records.
Yeah.
Or Tiger Woods wants to beat Jack Nicklaus's record.
Yeah.
What keeps you motivated? What are your kind of future goals, and what keeps you driven to perform at your optimum?
Yeah, thank you. That's why I'm playing football and playing golf and going swimming. It's a different things. Believe me, playing football is just a team. It's just a team play. You have to be and communicate. You have to know about things, some things about that, and it's a good thing. You just forget about everything. Playing golf is just you have to concentrate. You are fighting with yourself. You are thinking about how to do it right. Nobody, can help you. You're alone. you are not. You cannot account for anybody. You do it right or do it wrong. So, and the swimming, it's just to forget about anything. Yeah, I'm doing the 3 sports. That's right.
So in terms of surgery, what keeps you motivated? What is your next goal or incentives in surgery?
Yes, my motivation in surgery, yes. Yes.
Yeah.
The question is my
So
surgery, yes.
The question is, obviously, if you want to keep getting better and better and better,
yeah,
people have goals, they have incentives or trophies. So, for example, as academic, you want to write the number of research papers or the impact factor or something. What keeps you motivated as a general surgeon?
Yeah, my keeping my motivation for me it's to find some procedure where I can help people to saving their life and to get a Nobel Prize.
Okay, fantastic. Thank you.
Okay, I think there's somebody who said, what advice would you give to young people who aspire to become surgeons, but they're scared of seeing blood?
Yeah, don't. My advice: don't afraid of that. In my beginning of when I was a student in a medical university, I was not sure if I handle with the blood. Believe me, I was not very sure of that. So don't be afraid of that. Just go straight. It's not anything difficult.
Somebody said, what unique qualities would you look for in a great doctor? Which would be the great unique qualities?
You need, to be a good man, to be nice for the people, to love to helping people. This is the point.
Okay. Do we have any other questions? If you could just type in there, or if anybody wants to unmute the mic and ask the question verbally. No? Okay, so yes, somebody asked a question that they've joined a bit late this webinar, and they were asking if there was a recording available. Yes, we are recording this webinar, and at the end, we will upload this on the Young Professional Society YouTube channel. So if you go to the YouTube and you type Young Professional Society, we'll upload that hopefully by later this evening. And I would like to thank our guest, Professor Ahmed El-Mallul, who's in Warsaw at the moment in Poland, for your time and for sharing your knowledge and your experiences of being a general surgeon. And I'm sure those youngsters who have been watching, who have been listening, have been inspired. And some of the questions that they may have had about surgery and general surgeon, I'm sure you've answered them. And those people who want to know more, maybe you can drop us an email. I will leave our email, general email, in the chat box if I can get it. If not, you can email us on info@ypsociety.uk.
Doctor, I have a question.
Any question? Is there a question? Somebody?
Yeah.
Alan, is it? Alan?
Yeah.
Yes, please ask.
Okay. Is cosmetic surgery the hardest surgery to do?
Professor Ahmed, is cosmetic surgery?
Once more, please, because I didn't hear that.
Yeah, is cosmetic surgery the hard?
Cosmetic surgery, yeah. It's a very nice surgery. I told about the restriction cosmetic surgery. It's the name of it. Yeah, it's a very nice specialization. If you go for the specialization, it's very good payment, and there is not a lot of stress. There's a good, very good, believe me, it's reconstruction for the making the people feel good in their body.
Yeah.
It's very important thing.
Also, my father is a surgeon and he does abdomen surgery and trauma surgery. I just wanted to know, did you hear me? Sorry?
Yes, yes.
Yeah,
yes,
I hear you, yeah.
Yeah, so I just wanted to know if trauma surgery is hard.
Yeah, as well I said that we have here in Poland a system a little bit different. General surgery is a trauma surgery. In the UK, you have a trauma surgery maybe alone. Maybe just the trauma surgery is a hard work, yeah.
Okay.
Just believe me and say hello for your father.
Okay.
Okay, so I think somebody's asked another question here. What has been your greatest achievement in your career?
Oh, in my career, I would like to say a few words, I don't know what the career of the other here, but I came from a small village from Africa, in North Africa, to become the whole this way, and to become the head of the department, and to become as a professor, and to become as a man who saving people's life in a different place in the world, because I have been working to saving people's lives in Libya and Nigeria and other countries. It's inside of it the most things what I am like in my career. Yeah.
Yes, somebody asked. Yes, Professor was born in not Egypt, in Libya.
Libya.
Yeah. So I've met.
I love. Believe me, I love the Egyptian people. I love Egypt. So it's a nice country, nice people.
So I've been fortunate enough to meet you at several nanotechnology conferences around the world. Now, obviously, you're a practicing, very successful surgeon who's very, very busy. Do you feel that, obviously, you go to these nanotechnology conferences, do you feel that nanotechnology has a lot of potential and, which you could utilize in your work in surgery and make more advancements?
I think that...
Yeah, just believe me, I'm talking now to all the audience, especially for the Professor Al-Wakar and Dr. Nasser Ali. I think the nanoparticles is gonna improve. It's the point where we can improve our surgery, and we will make the next step with the nanoparticles. We have a step in open surgery until 19th, I think. It was improved very good. And after 90s, 93, 1990, 94, 95, the world just began to making a minimal invasive surgery. It's a big step for the improve the kind of surgery and the quality of surgery and the quality of life after surgery. And I think the next step we will make it will be with the nanoparticles.
Okay, so we'll take a final question here from Dr. Musa, who said, if you were to sort of go back in time, would you choose this career again?
I would like to say hello to Dr. Musa. Dr. Musa is the dean of the university in Zintan. Believe me, Dr. Ali, very nice guy, very good educated man, and he's speaking English very well. So I believe in one. I believe in one that we always make the same mistakes. So even if you give me the other chance, I will make the old mistakes before.
Doctor, I have a question.
Yes.
The final question from Alan. This is your final question, okay? Because we've
Okay.
Okay. It's not a question, but it's a statement. I think nanosurgery is harder and more riskier, as the robots don't have hands and the delicacy of our hands and our skeleton.
You know, we still not have a nanosurgery. It's just a scientific work. We have to find how to use the nanoparticles in surgery. It's gonna, the nanotechnology, it will help the surgeons to handle a difference and to make the operations more successful, more clear, and less problematic.
Okay, thank you very much. I think we've just gone over our hour. Thank you very much, Professor Ahmed, for your time. And I'm sure there was a lot of interest in people have found this useful. I know there's a lot of questions as well, and people want to sort of, we were not able to live stream on Facebook, but we will upload this on our YouTube channel. People are asking on where on YouTube channel. Yes, if you go YouTube, Young Professional Society, we should be on there. And hopefully later this evening, you'll see this video on YouTube. Thank you very much once again to everyone for joining our meeting today. And thank you, Professor Ahmed.
Thank you very much. I would like to say the last word for the young people. This is the place where they can learn a lot. Just became for this webinar and just following the young professional society. Believe me.
Thank you very much. Everybody have a good evening and stay safe.
Thank you. Stay safe.
Thank you. Bye-bye.
Thank you.
Bye,
Thank
Doctor.
you, sir. Thank you, Professor. Thank you. See you.
Thank you.
Bye-bye.